We will have this recorded for anyone who's not available or anyone who wants to rewatch it for your viewing pleasure. And we'll be posting it on our Main Care YouTube channel. Hopefully within the week, we will send out a notice when that happens. Okay, now with all that said, I'm going to hand things off to our fearless leader here at Main Care, Director Michelle Probert. Michelle.
Thanks so much, Maggie. I appreciate it. And I took direction. I have my lunch right here. I won't eat while making my introductory remarks because that wouldn't be pleasant for anybody. But appreciate everybody being here today. And I say that on behalf of our Transforming Maternal Health team here at the Office of Main Care Services with Maine DHHS and the state as a whole. We welcome you to our inaugural Perinatal Rural Regional Planning meeting, which is a mouthful, but is really exciting. There is a lot of really fantastic energy and passion around improving maternal health outcomes in Maine. I am a mom of two beautiful children. I think that many of us have had direct experience in how important a team-based approach to care, a patient-centered approach to care can be so and is so critical to achieving maternal and infant health outcomes. I have been very privileged in my own life in terms of access and coordination of care, and even considering that, I've had direct experience at how listening to someone as they're giving birth can be directly related to how that birth goes and what the outcomes are that we see, and that time after birth that can be both so exciting and also so isolating and scary, and how there are a number of different kinds of professionals who all can and need to work together to make sure that people get the care that they deserve. It's a topic that I could personally talk on for hours about, as I'm sure all of us could, but I won't do that right now. Instead, I'll just say that it's great to have so many of you on the call today. I'll say that this was echoed, or this is an echo of last July when we had our first public meeting to determine interest in a state of Maine application for the Transforming Maternal Health Model, or TMaH. And it's just so clear that this is a priority for our state. I've been informed that our registration for today included people from all 16 counties, every hospital in the state, birthing and non-birthing hospitals alike, EMS providers, and representatives from several different professional organizations. So it's great for us to kick off this work with truly a multidisciplinary and statewide approach. I really want to thank those of you, and there are many who supported the department and the state in our application for this opportunity. We had meetings with many of your organizations. You took time to speak with us, sharing information, knowledge, writing letters of support, and all of that was really critical. Many of you probably know this, but we were one of only 15 states who were awarded participation in this model. It gives us an opportunity to leverage up to 17 million over the next decade to address maternal health concerns. And so this is truly a great opportunity, and especially as we are in a context right now of a scarcity of funds. And so the fact that this opportunity is continuing on in an area where we really need the support is very much appreciated. So we are looking to leverage this opportunity to improve access to care, to advance patient safety, to focus on that whole person care delivery. And we all, and many of you all, know firsthand the challenges that we're experiencing in the state, especially in our rural areas. We know about the closures of the birthing centers and different hospitals, and so recognize that we certainly don't want to wait any longer for the timing of this work. So we are going to be holding a number of more events like this one. We look forward to that, and the emphasis will absolutely be on partnership, collaboration, as well as innovation. So we look forward to your input, your creativity, to help us to collectively improve maternal health outcomes here in Maine. And I thank you very much and look forward to the conversation and the work over the next decade. So thank you. Maggie, I know you told me who was going next and I already forgot. So
That's no problem. We are going to now have Dr. Amy Belisle kick it off. Thank you, Michelle.
Thank you very much, Director Probert, and to the MaineCare team. It's great to see all of you joining us today to talk about the Transforming Maternal Health Model. And today is really our kickoff of our Rural Regional Planning for Perinatal Health project. I'm Amy Belisle. I'm the Child Health Officer at the Maine Department of Health and Human Services, and I've been working with the MaineCare team. Director Probert gave welcome and introductions. I'm going to talk briefly about the work that's being done in the state to strengthen Maine's perinatal systems of care. We'll then have the MaineCare team talk about the Transforming Maternal Health Model and first steps of the Perinatal Rural Regional Planning process. We are trying to get feedback from all of you today. We're going to do that through the Zoom poll system. Some of them are asking you to type in some sentences and feedback. Others of them are multiple choice polls, but we really are encouraging you to participate in that because we're going to aggregate that information and use that to inform our planning process. We can go to the next slide. So in terms of the TMaH grant, it's really a wonderful opportunity for us to continue to strengthen our perinatal systems of care in Maine. As many of you know, Department of Health and Human Services has really placed an emphasis on this since 2019, although many of you have been working on perinatal health for many years, including many of the programs at the Maine DHHS and the Maine CDC, including our maternal and child health program. Part of this work started at DHHS back in 2019 when we started to work on reducing our infant mortality rate through safe sleep efforts, as well as implementing the Eat, Sleep, Console protocol at all the birthing hospitals to improve care for substance-exposed infants. We also developed in 2019 our Perinatal Systems of Care Working Group, which many of you participate on a quarterly basis. And we've been doing foundational work to improve and standardize our levels of care. And we asked all of the birthing hospitals and non-birthing hospitals to do the level of care work with us back in 2019 to 2022. We created a level of care map as well as policy and guidelines for the hospitals back in 2022. I'm going to have you go to the next slide. As part of this work, we have developed a shared vision, goals, and strategies to help guide our work with the Perinatal Systems of Care Working Group. And part of some of those shared goals are to achieve the best possible maternal health and birth outcomes in all areas of the state and across all populations. We do this by looking at our infant mortality and maternal morbidity and mortality rates. We also want to increase overall access to high quality services focused on whole person care for pregnant women across the state and ensure all mothers, pregnant women, and infants receive the right care at the right place at the right time. And that really speaks to our levels of care across our hospitals. It starts with our non-birthing hospitals and our home births to our level 1 hospitals, which are our community birthing hospitals, to our level 2, 3, and 4. And in our state, we have several level 2 hospitals at Maine General and Central Maine Medical Center, as well as Mercy Hospital. We have our level 3 hospital at Northern Light, Eastern Maine, and our level 4 hospital at Maine Medical Center in Portland. You can go to the next slide. As we do this work, we also want you to be aware that there has been a lot of data collection and evaluation to inform the work. We're not starting from scratch. Back in 2020, the Perinatal Quality Collaborative for Maine, which is at the Maine Medical Center's Center for Quality Improvement, did a whole needs assessment on understanding and addressing the drivers of infant mortality in the state. The Maine CDC has done an early childhood comprehensive systems needs assessment, and the Permanent Commission on Racial, Indigenous, and Maine tribal populations also did a report on racial disparities in prenatal access in Maine in 2022. Our Perinatal Quality Collaborative for Maine is strong in the state, and they've been working on a roadmap called Maine's Perinatal Systems of Care Roadmap to help guide the work. And the CDC also has published a new maternal health data dashboard that's online and available for use. Recently, there's been several needs assessments, one done by market citizens research with the CDC on perinatal health disparities. And then we have the team from the Rue Institute who's been working with Maine Health and the Rural Maternity Obstetric Management Strategies Program, or what you might hear it referred to as our moms. They've done 2 parts of a needs assessment on the obstetric workforce in Maine's rural hospitals and went out and did site visits with all of you to get information for that. We also have the Maternal Fetal Infant Mortality Review Panel at the Maine CDC and the Maine Medical Association, which has been guiding our work, looking at data and case studies around maternal fetal infant mortality. And the Maine Doula Coalition has done a workforce assessment recently. And the Maine CDC has also published a study on perinatal mental health in Maine. So we're using all of this information to inform our transforming maternal health work, as well as the rural regional planning work. And go to the next slide. So our first Zoom poll question for you is, what are some of the top 3 challenges that you're seeing in rural perinatal health? And we'll be launching the poll. You should be able to type in some of your concerns or challenges around rural perinatal health. We're going to be aggregating this information to help inform our planning process, as well as share this at one of our upcoming meetings. And we're hoping to get at least 80% of you to put information in around challenges. And if you're having challenges using the poll question, we're also happy to get this information through the chat. And if anyone wants to come off mute and talk to us, we're happy to get some of the challenges that you're facing if you want to share that with us in the group right now. Thank you for all that are answering. We have about 130 people on the call. We have about 70 answers so far, so thank you very much. And Elizabeth, I see your chat in the chat box. If you're not able to do the poll, feel free to just chat in top 3 challenges into the chat box, and we'll get all the information together. As people continue to type in, I will say, one of the challenges for us at the state, the Department of Health and Human Services, is making sure that we are aligning all of the funding opportunities for groups that are working on perinatal systems of care work. As you are aware, we have baseline funding for this work at DHHS. Some of it is at MaineCare, some at the Office of Child Family Services, the Office of Family Independence, and the Office of Health Insurance Marketplace. The Maine CDC also has foundational funding through their block grant for Title V and through Maine Families Home Visiting, WIC, and Public Health Nursing. But we are also partnering on all of this work with the Department of Education and the Department of Public Safety, who house early intervention for me, as well as our programs around EMS for children. The state is very fortunate to have funding through other grants, including the Maine Medical Association Center for Quality Improvement has funding through the Perinatal Quality Collaborative for Maine. Maine Health has funding through their Rural Maternity and Obstetrics Management Strategies, as well as through their neonatology teleconsult network called MaineNet. They also have the MERGE grant to enhance rural obstetrics training. And the Maine Medical Association also has funding through the maternal mortality funding. And the CDC has funding through a state maternal health innovation and data grant. So there's lots of different opportunities coming in around perinatal health. And one of the challenges for us is to try to align this work. And we were delighted, as we're going to end that poll, that MaineCare was awarded the Transforming Maternal Health Model funding in January. So I'm going to turn it over to the MaineCare team and Maggie Jansen and Olivia Alford to provide some background.
Thanks, Dr. Belisle. Okay, so thank you all for doing that first Zoom poll. And now we're going to talk about TMaH, which that's what we refer to the Transforming Maternal Health Model as, TMaH. It is the newest Centers for Medicare and Medicaid, also known as CMS. So from now on, you will hear me saying CMS. That's what I'm talking about, Centers for Medicare and Medicaid. It's the newest model designed to focus exclusively on improving maternal health care for women enrolled in Medicaid. It's a model that supports state and Medicaid agencies to improve access, treatment, outcomes, and experiences for patients. And it's funded through CMS at the federal level, which is why it was the Office of Main Care Services who had to be the office within the Department of Health and Human Services who applied for it and who now leads it. But we really see this as a state model and something that we want to include as many partners in as possible. This is a model that is a 3-year pre-implementation period during which we will receive targeted technical assistance from the federal government, and then a 7-year implementation period to execute the model. And just to mention, as with all cooperative agreements where we are partnering with the federal government, exact implementation details are subject to federal review and approval, along with our state level processes. So we just need to keep that in mind as we go forward. Okay, so we, as Director Probert mentioned, CMS released the notice of funding opportunity for the TMaH model in June, at the end of June of last year. And we then held the very first public webinar about TMaH approximately 2 weeks later, and immediately began to receive email after email expressing support, just a real excitement around a main application. There was just so many different external and internal partners reaching out to us to share their experience, their knowledge, and their passion, and their concerns, especially concerns about a decrease in access to perinatal health resources across the state, especially in the rural areas. And that was really one of the main reasons we decided to apply. We were also drawn to that 3-year planning period, which we feel opens up some thoughtful and deliberate planning involving as many partners as possible. And of course, we're excited about the opportunity to leverage that $17 million in federal funds. Next slide. So now to the nitty gritty of what TMaH is all about. TMaH focuses on 3 main areas, or what they call pillars. The first pillar is all about access to care, infrastructure, and workforce capacity. Does somebody have a question? No, okay. Second pillar is quality improvement and safety. And the third pillar is whole person care delivery. On to the next slide. So this is where we get down to the real substance of TMaH. So within those 3 pillars of TMaH has 9 federally required elements that all state participants must achieve. And those are what are listed there in that first bracket of the page. And then on to that second bracket at the bottom, you'll see some main specific selections. During the application process over the summer, the main team was able to select some elements from a menu of options, and the 4 we chose, we are now referring to as main specific selections. And you will see that the regional partnerships in rural areas is one of those. I'm going to now briefly touch upon the first 9 federally required ones, and then we'll really dive into the regional partnership in rural areas. So let me pull up what I've got here. Okay, so on to these 9 elements. I'm going to try to go quickly because I know it's a lot, but I want you all to know a little bit about what we're doing. So we're working on all of these elements. But it's important for us to let you know, and I think most of you already know, that Maine has several areas within these elements where we are already meeting or nearly meeting federal requirements already. The first, number 1, is an example of this: increasing access to certified nurse midwives. Maine already has parity in pay and a full practice scope for certified nurse midwives. We have one of the greater portion of births attended by CNMs compared to the national average. But we do know there's more to explore to continue to support this workforce, and we plan to roll that out over the next 10 years under this element. Number 2, increase access to licensed birth centers. Birth centers are freestanding facilities using a midwifery model of care, offering an alternative birthing experience for lower risk deliveries. Medicaid agencies have to cover these facilities, if they are licensed by the state, but Maine does not currently have licensure or accreditation in place for these facilities. However, several states do. So as a first step, we're planning to begin learning about what other states are doing. So that's what we're planning to do under element number 2. Element number 3, covering doulas under MaineCare. So this is an expectation of participation in the TMaH model. I'm very proud to say we're already underway with meeting that goal. We've contracted with some experienced Maine doulas to begin informing that work, supporting the establishment of a statewide doula council. That doula council will advise on the design and implementation of MaineCare coverage of doula services. Number 4, improving data infrastructure. This is really about making data actionable to DHHS, to individuals accessing services through DHHS, and to providers serving MaineCare members. Maine has a strong health information exchange already, and we're already doing a lot of cross-agency data matching, particularly within WIC and OFI. We want to start using TMaH to expand and improve on that work within DHHS. Number 5, implement a value-based maternity services payment model. This is a big one, and lots of information to come on this. A lot of the work is going to largely be driven at the federal level. However, we have been assured that we will be able to give a great deal of input from our stakeholders here in the state along the way. Like I said, much more to come, but we do know there will be provider infrastructure payments to support care delivery, and there will be quality incentive payments involved in this. Number 6 and number 7 are regarding work that is already being done and has been done for quite many years, supporting implementation of quality improvement initiatives. This comes down to supporting that continued successful implementation of the AIM bundles, those Alliance and Innovation in Maternal Health Patient Safety bundles. That's work that's currently being done in an excellent way by the Maine Perinatal Quality Collaborative, the PQC for Me. In 2023, the PQC for Me launched the Severe Hypertension and Pregnancy AIM bundle. And they're now planning to roll out the perinatal mental health conditions bundle very soon. And in later years, there'll be several other bundles coming. TMaH aims to support that work going forward. We're also supporting work around birthing friendly hospital designation. Currently, all of the main birthing hospitals meet this designation. But over time, we're anticipating that expectations and requirements of this designation may change at a federal level, and we plan to use TMaH funds to help support birthing hospitals maintain that designation. 8, increased screenings, risk assessments, and follow-up. We're planning on engaging community and clinical partners in care journey mapping, and we plan to support community and clinical implementation needs to improve and standardize screenings and referrals for behavioral health and health-related social needs. And finally, number 9, increasing use of home monitoring services. So right now, MaineCare currently covers a limited scope of home monitoring for patients that are eligible for home health services, but we are very, very interested in supporting current work being done around remote monitoring pilot programs. We're looking at what our moms have been doing around diabetes, hypertension in the pregnant postpartum MaineCare member population, and we hope to eventually develop policy and reimbursement to sustain that work. Okay, lots of info there. Feel free to drop questions into the chat as they arose as I talked. Now we can move on to the next Zoom poll question. What are the top 3 opportunities in rural perinatal health? So things that are feeling hopeful or like good opportunities right now.
We're very interested in innovations and what you may have tried in your hospital that's working. Maybe you've tried it in your region, or maybe you've looked at other states or what other towns or cities are doing. If there's some opportunities that you want to share with us or some areas where you think TMaH should be looking, that would be very helpful for us as we're in the planning process. And if you are unable to put it into the poll, feel free to put your feedback into the chat box. We're also very aware that many of you are part of the Our Moms work with Maine Health. You may have been working with the Maine CDC or the Perinatal Quality Collaborative. If there are some things that have worked really well, some of these pilots you said, these are the greatest, this has really worked well for our hospital. We'd love to hear about what is working well in some of these pilots and some of the things that you think should be spread statewide.
All right. Looks like most people have put in their answers, and we can move on to our next slide, please. Now we get to talk about what I think a lot of you are here for, which is the rural regional planning part of the TMaH model. As we saw a few slides ago, there are these overarching goals for the model, but now we get to focus on the more immediate steps that will help us achieve these goals. And as we begin with this planning, TMaH is really planning and excited to support regions. We're excited to see this in the optional menu. We laser focus right in on it, and have chosen to put it first and foremost as what we focus on now in our first year of TMaH work. So this support will include dividing the state into regions and setting goals, and there will be a request for funding application release, hopefully by June, and that funding will be used for convening and planning for these different regions. Next slide. So discussing the initial approach to rural regional planning for perinatal care. So we're going to first start in the next few slides with reviewing a variety of maps of the state of Maine and discussing ways that the state is currently regionalized. You will see that there's a lot of different ways that the state is regionalized. We were quite interested in that actually as we started our investigation. We are going to have a Zoom poll once we complete the review of the map. We're very, very interested to see what you all think about the best way to regionalize our state when it comes to perinatal care and planning. We are going to review the feedback we received today internally, and we are going to share results at an upcoming in-person meeting on June 12th. That June 12th meeting, we are going to use that time to start strategizing our regionalization plans and begin doing goal setting. There will be a few reports to read in advance of that June meeting, and those will be sent out to people once they register. Some of you have already received a save the date for that, and we are going to send out the formal invitation very soon, so please keep an eye out for that. Okay, next slide. All right, this is our first map. Public health districts. In 2008, Maine created 8 public health districts, as you can see here on the slide, based on population, geography, and hospital service areas. The tribal health district was added in 2011. Our initial thought when we look at this map is that 8 to 9 regions feels like a lot of regions. We are thinking it might be helpful to reduce that to potentially 4 to 6 regions somehow, give or take. Interested in your feedback. But we wanted to share this map with you, have you see what the public health districts are, so that we can have a discussion about where we want to go with this. Next slide. Next, we have this map, which demonstrates the state divided into 2 regions, southern and northern. Many of you, I hope, know our fabulous perinatal outreach nurse educators, Ann Boomer in the north and Emily Watson in the south. They're covering those 2 regions. They're working really closely with the direct care teams at each hospital, and they're just fabulous. And we just really looked at who they're covering, who they're working with, and went with that and made this map based on their work. And we can go to the next slide. Okay, this map separates that last map in a similar way, but also accounts for the fact that issues and concerns may be different in coastal and inland regions. Those circles on the map indicate that the level 3 and 4 hospitals in the region. So we're really looking at perinatal referral pathways there, and thinking that that may be a helpful way to regionalize when it comes to perinatal care, rural regional planning. Next slide. This was another regionalization map that we found very interesting. This is how Maine EMS divides up Maine into 4 different regions. Region 1 is York and Cumberland. Region 2, Oxford, Franklin, Somerset, Androscoggin, Kennebec, Saginaw. 3 is Lincoln, Knox, Waldo, Penobscot, Piscataquis, Hancock, and Washington. And 4 is the county. Okay, next one. Then to round it off, I found this one, which I thought was also very interesting. The DOT region. It separates the state into 5 Department of Transportation regions. So similar to the EMS regions, but slightly different. Okay, so now that you've seen those, we're going to go on to this next slide. And you can see all of these. And then let's go ahead and put up the Zoom poll. And we would love for you all to put in your choice of how should regions be identified for planning purposes. we're not going to hold you to this. We're just sort of interested right now in first thoughts. And Amy, if you want to jump in with any thoughts too, I know you've had conversations around this as well, as people put in there.
Yeah, I think we're ultimately looking to get to anywhere between 2 to 6 regions. I'd say 4 to 6 regions to do. Sorry, I think ultimately we're looking to get to 2 to 6 regions to do rural regional planning. We're trying to get a sense from the communities what they would find helpful. We also know that because of the way that the levels of care are set up in the state, there will be rural regional planning, but we're also going to have to account for the fact that we have one level 3 hospital in northern Maine, we have some level 2 hospitals in central Maine, and the level 4 hospital in southern Maine. So we have to look at this both as a region, but also as a state, how this is all going to come together. We envision that we're going to have some regional planning, and the regions are going to have to come together to do a statewide plan to really look at the continuum of care from prenatal to labor and delivery care to postpartum care. What does that look like for moms and babies throughout the state? We know it's going to be a little bit of a complicated process, but we are hopeful that we'll have a lot of different voices around the table to inform the work. It looks like we have about 104. So I think almost everyone has given us some input on this. So I think we can stop the poll, and we really appreciate folks' thoughts. And if you have thoughts, feel free to put them into the chat box as well.
That was interesting. I briefly saw the flash up. Is there a way? There we go. Can everyone see that? Viewing the poll results?
So we have public health districts condensed to 4 to 6 regions, 2 regions, that was the highest, 43%, 2 regions north and south, that was 6%, 4 regions based on referral pathways, about 16%. Maine EMS is 4 regions, that's 25%, and Maine DOT is 5 regions, 10%. So thank you, that's really helpful, and we'll continue to look at the maps so that we can make a decision with you all moving forward.
Okay, thank you all. All right, so this is a visual we created to outline the work we're planning to do with successful regional planning in a visual form. We want our work obviously to center on the goal of healthy moms and healthy babies, and our partners include all of you that you see in the outer circles. We also know that including families in planning is going to be a key component to the work, and that each region we will want them to include family partners in goal setting and planning. We are aware, though, in looking at this circle, that we may be forgetting important partners, and that is why we have our next Zoom question. We can move on to that one. Who's missing? Who's missing from the table? Who's missing from this meeting? Who's missing from conversations that any of you have been having recently that you've noticed just have not been there? So please let us know, because we want to invite them. We want to have all the voices that need to be at the table heard.
There was a request to see the diagram again, so I'm showing it here. Although I think the question can be asked for really this conversation in general, again, at your local level, or at this meeting today, who's missing.
How are we doing on this answer? I'm not able to see the numbers.
We're at 41%. I can end the poll whenever is good. Maggie, just let me know.
Let's see if we can get to 50%. Okay.
Yeah, 45. Let's end it there.
Okay. All right. Thank you. Okay. So how will regions, whoops. So this is all about the next steps. How will we be supporting regions in this work? Like I said earlier, plans and timelines are going to be subjected to CMS review and approval. But let's go on to the next slide. We are very excited about the fact that we have hired, or tentatively, we have offered a position to Kelly Bowden for the Perinatal Rural Regional Planning Coordinator. As many of you know, Kelly is a longtime neonatal intensive care nurse. She also spent close to 20 years working as a perinatal nurse outreach educator throughout the state, and has been a co-author of many of the needs assessments and reports that Dr. Belisle reviewed this earlier in this presentation. So we are very hopeful that she will be able to take on this role once we get final approval from CMS through their processes. So we're looking forward to that. Once we have Kelly in the role officially, she will be convening the regions, holding virtual meetings, offering a framework for regional rural planning, and bringing together leaders to create a continuum of care. Next slide. Okay, now we are on to this slide, and I'm going to introduce Olivia Alford, Associate Director of the Delivery Services Reform Unit here at Maine Care. She's going to take this on and then do the Q&A for all of us. Olivia?
Great, thanks, Maggie. And then I'll just go back to the next step slide right after this one. But great to see you all. So part of what I'm certainly supportive of and feel the urgency around, and we've heard loud and clear from everyone, is we want to get this going right away by also planning to give out funding to regions to do this work themselves. So while there will be this coordinator at the state level, also we will be dispersing funds to regions through a request for application process. What that means, it's essentially a competitive process to the extent that there could be limitations on funds, that will go out to identified regions and parties to propose how they would like to engage in regional planning that aligns with the framework set up by the state. Again, we're using this meeting and several past conversations and all the existing work to build out a really, I think, good, inclusive, broad set of expectations so that regions can do with it at the local level what they need to do to either start regional rural planning for the first time or to re-engage, as I know many organizations and many regions have already done some rural regional planning, and that this influx of funds may support them going further. So we're carefully drafting this, again, subject to state level processes and CMS approval. But what we intend to do is to provide funding out to regions. The amount of the funding is a little bit TBD still because of working through all the budgetary processes, but intended to be meaningful but not exorbitant, depending on the number of regions that apply as well. The funding could go towards regions' needs around data collection analysis, technical assistance, costs for holding meetings in different spaces and materials, stipends for participants, and then the administrative costs associated with like making sure that these things progress. So we will look forward to trying to get this out the door as soon as we can with, again, state and federal processes, hopefully this summer. And I will go back to the next slide. And Maggie, I'll just hand it back to you before we go on to questions.
Okay, thank you. There it is. Okay, we are hosting, like I talked about earlier, a session in Freeport, an in-person session in Freeport on June 12th at the Harrisicot Inn. This is going to be a joint meeting, in-person meeting with the Maine CDC's Maternal Health Task Force, which is also meeting in the same venue that day. So we sort of co-opted their space, and we're all going to be there together, which is nice. I'm looking forward to it. We're inviting participants to attend the full day. We're planning to do our event in the morning, and then the CDC's Maternal Health Task Force will have a lot of the afternoon. However, in the afternoon, the Maternal Health Task Force is going to open up a breakout session specifically for rural health planning, which is why we're hopeful that participants come for the full day to do a lot of work around rural health planning. We are looking for people who are willing to lead the work, think strategically within their region, to come and attend the meeting. This could be community partner agencies, hospital leaders, anyone who's willing to work on this work to improve maternal health and care. And we will talk more, we hope, about the RFA process at that meeting. Okay, we can go on to the end slide now.
All right, so we
have one more poll question, Maggie. We go back.
I'm sorry. Thank
Thanks,
you.
Amy.
What should be the top 3 goals of our rural regional planning for perinatal care initiative? What do you all want us to be focusing on? We want you to help guide us.
And one thing, since we're talking during these polls a little bit, one thing I want to emphasize too is our plan, at least our proposal, when we applied for transferring maternal health, we put a lot into this rural regional health planning line, and we intend to continue doing this for at least 6 to 7 years. So the extent that some regions are going to be at a certain readiness right now and move at a different pace than other regions, we're trying to have some continued support throughout the next 5 to 7 years, so that regions can again meet you where you are, and then have multiple rounds of these like releases of funds with alignment as we progress along this. So again, action oriented folks who are ready to go right away, great. Opportunities for those who are less ready to articulate full needs at this point and really need to start slower. And we will send out these full slides, but also when we actually do have the request for application ready, we intend to hold a formal informational session at that time. So you'll have plenty of opportunity to see the product and ask questions at that time as well.
Hey, Julia, how are we doing?
Right at 35%.
Okay. We can keep it up for another 20 seconds or so, and then we will move on to opening up to questions and answers.
The one thing I was going to mention, so Thursday, June 12th in Freeport is the TMaH Rural Regional Planning effort with the Maternal Health Task Force. I think some of you may know that on Friday, June 13th, is the Perinatal Quality Collaborative for Me annual meeting, and they are focusing on maternal mental health at that meeting. And so one of the reasons why we're doing this is so that if people have to travel and they were going to go to both days, they would be in the same location. So I just wanted to put that plug in there that the PQC for Me meeting is the next day in Freeport.
Okay, great. So I'm gonna take down the slides. We have our contact information, but again, the slides will go out and we can also put those in the chat and we can open it up for some questions and answers, which I'll help facilitate. Folks are asking for more information for the June 12th meeting. I know, Amy, you just provided some more. I think maybe someone could jump in, Amy or Maggie, to talk about, again, reiterating requests that we have somewhat limited space and we're trying to do a work session style meeting on the 12th. So we do ask that organizations, large and small, try to designate individuals that really are gonna be the ones digging into this so that we have room for a wide range of participants. Lisa, Amy, Maggie, you want to add anything to that?
No, that is exactly right. It is a limited space, and so we unfortunately are hindered by that in terms of the numbers that can be there. And I know NEPQuinn is also having their virtual meeting, their virtual spring concert. I went to a child school concert last night, sorry, conference. And yes, that was not great timing. We did not realize that was happening when we went with June 12th, so we apologize about that. But as we've stated before, we are going to have many of these meetings, both virtual and in person, going forward. This will not be a one and done. This will continue.
Maggie, I'll just chime in behind that and the other comments to say I think it's a great opportunity for people to start talking within their regions. So, we're trying to catalyze and support this work, but ultimately it's really the regions sort of have to kind of sort of self-identify and come together, right? So given that we just have the hard reality of we just can't fit everybody there who would like, it'd be great to start talking with each other about, okay, who best in our area, who would be best to go if we've got a limited number of representatives, and how do we start that collaborative work? So.
Yes, Emily.
Yeah, I was just curious. I know you mentioned that Kelly Bowden is going to be stepping into kind of the regional. I apologize, I'm forgetting the name of the title that you mentioned, but I understand the concept. And so clarifying that after the regions are kind of decided on, that the goal would be to have, is it one person per region kind of represent that region, or is the idea more broadly that Kelly would kind of facilitate collaboration and communication within those regions, but not necessarily with one specific point person in each region? Let me know if that question doesn't make any sense.
Yeah, no, it does make sense. Thank you. So each region will be responsible for facilitating themselves, designating a facilitator for themselves to do their regional work. Kelly will be a sort of maybe I should use a different word. She'll be a liaison, is maybe a better word, with all the regions so that she can be helpful, so that she can convene not just one, but the regions, whether that means the one administrative sort of backbone organization or representing the group, or the regions at large, to engage in state level planning so that what regions are doing in isolation doesn't become misaligned with each other and how it needs to work at a state level. Again, acknowledging how our state is situated with the different levels of care, that really can't happen. So she's more of a liaison with all the regions and a support. That's how we're envisioning that working. But again, open to feedback about, again, what level of support do the regions need and what type of liaison activities are helpful so that you can feel coordinated across the state. And some parties here are going to be involved in multiple regions, or at least their organization is going to be involved in multiple regions. So happy to hear your thoughts on that.
Thank you. It does
And
seem that there would be value in having a point person per region. I recognize that that comes with staffing and, financial constraints. And that may not be the sense of everybody on the call, but I just feel like it would be nice for different organizations and facilities and care team members within a region to know, okay, my team of person in my region is this person. All of those regional people are going to convene with Kelly to make sure everybody's speaking the same language. But that's my thought.
Yeah, thank you for that. I think that's a great point. And if people have conflicting thoughts or other thoughts, I'd love to hear it too. I think, generally we might try to keep it open a little bit as we hear, but I think that would be great for each region. Will the regions, so Joseph is asking, will the regions be outlined prior to this June 12th meeting? That would be our goal, again, because we think the regions will need to be identified to release the funding opportunities. So we're taking the input today, and you can reach out to any of us if you haven't already on this topic. But our goal is to, again, with this first phase, get funding out the door. So we do anticipate having to make some decisions quickly. All right, we have 1 minute left. Any final questions to throw in the chat? If not, I might turn it over to Maggie for closing remarks. Thank you all.
Thank you. I think my closing remark is just huge gratitude to all of you. I always get teary in this kind of situation because I see the passion. I know the struggles too. We very much understand it, and we want to help, and we are looking forward to continuing these discussions so that we can move forward together. And thank you all for being here. And we're hopeful that you found this helpful. And please reach out with questions, concerns, feedback, and we're going to be in touch with more information as we go forward. Thank you all very much. Take care. Bye.